Hello, I'm Andrea Riposati, CEO and co-founder of Dante Labs. Today, I'm here to discuss Dante Labs' industrial solution to the COVID-19 epidemic. First, let me give you a quick snapshot about Dante Labs. We are a genetic testing company located in Italy with a 1,000 square meter sequencing center and with proprietary software specialized in the whole genome sequencing. To date, we have analyzed about 20,000 whole genomes. We serve users in 97 countries, and we have internal software both for lab management, LIMS, and to generate personalized reports based on the user's medical history. Our software takes data from whole genome sequencing, so raw data, and then creates reports that take into account a user's medical history, medical records, and description of symptoms. Thanks to these reports, we were able to create our own sequencing center last year in Italy, so in the European Union, where we have a high throughput for workflow of whole genomes, sequencing thousands of genomes every month. We work with the most famous and most influential organizations in genomics worldwide, including universities such as Harvard and Cambridge, as well as the largest companies. Also, a lot of these companies, they issue a press release about Dante Labs when we partner together, even if they're much larger than us. But now let's go to COVID-19. We all know that COVID-19 cases are growing worldwide in different countries. Since the very beginning of the epidemic, a clear and simple message has been given about test, really about testing a lot of people. Testing, in fact, allows to monitor the situation, monitor new cases. And now that some countries have managed to reduce the number of affected individuals, testing is extremely useful in the so-called phase 2, which means to allow people to go back to work and to re-enter normal life. Now, the issue with testing is that the majority of labs, traditional labs and hospitals, can only analyze a maximum of 50 or 200 samples per day. The reason is that these hospitals still use very manual operations, and they're not equipped with automated solutions. And that makes perfect sense because these hospitals do not have only COVID-19 cases to manage. They have cancer, they have rare disease patients, they have emergency cases. Accidents keep happening, diseases have not disappeared. And so it actually makes sense that hospitals have been built with limited equipment so that they can manage a wide array, a wide variety of cases. However, today, with coronavirus spreading, then hospitals are not equipped to manage and analyze thousands of samples. So the solution is to use automated workflow, both on the hardware and the software side. There are different companies worldwide that produce automated sample handling system. However, there is also a data analytics problem. So let's start with the hardware. So in terms of hardware, in order to analyze thousands of samples per day, you need to have automated liquid handling systems, and then you need to have a high number of PCR machines, ideally qPCR machines, so that they can run samples in parallel. A qPCR run lasts about 2 hours. Usually, one machine can analyze 96 samples at a time. So in 1 hour, if you have 10 machines, you can analyze about 96 times 5 samples, which is 480 samples per hour. Now, there is an issue that actually kits, diagnostic kits, come also with positive and negative controls. Usually there are 2 positive and 2 negative controls. So actually you're not analyzing 96 samples per hour, you're only analyzing 92 samples per hour. Now, before the qPCR, you have liquid handling and RNA extraction. With liquid handling and RNA extraction, you can also usually analyze about 96 samples in 1 hour or 90 minutes. And again, you need to have a lot of space and you need to have different systems running in parallel so that you can analyze thousands of samples in a day. However, once you have the data, then you need to create the reports and also you need to interpret the data, which is even more important. Data interpretation is not as straightforward as data generation. In fact, each run in a qPCR machine has different values and different thresholds, so that positive and negative controls depends really on each different run. So once you have the data from the qPCR machine, what you do is that you check that data against the internal control, both positive and negative, and then you have what's called a virus target. And this virus target basically shows you whether a sample is positive or negative, so whether a person is affected by the virus or not. And the qPCR runs cycles, and you can see that really when you have the exponential growth is where you can give a precise and definitive answer about whether or not that sample is positive or negative. Taking a step back, if you think about the entire process, what you really do is that, first of all, in a lab, you receive the samples, so of course you receive the virus. Now, today, the majority of sample collection kits inactivate the virus. So in theory, you should receive viruses that are inactivated, so they're not dangerous. However, there can always be the error, the human error. So you may still receive samples where the virus has not been adequately inactivated. So the first step in your workflow is to access and accept the samples in a BSL-3 room where you have negative pressure and to work under biosafety level hoods, so that even if a sample was not inactivated, the virus is managed just inside the hood and it does not exit the hood. And then on top of that, the virus does not exit the room because it's BSL-3 safety room with negative pressure. So in order to build such a room, you need a room with 2 antechambers with special safety precautions such as an emergency shower, a sink, but more importantly, you need a lot of hoods, like safety hoods, biosafety hoods inside the room, and then you need an advanced air handling system so that you can keep a negative pressure, a constant negative pressure in the room and avoid that the air from the room gets outside. Now, once you receive the samples in this room, you inactivated them with a liquid buffer inside these hoods. Then the samples are ready to be moved to the second room, either by a special lab passing window or by using a closed like sample transportation module. Then the samples reach the second room where they enter RNA extraction, and then liquid handling, and then qPCR preparation, and finally qPCR. So for the RNA extraction and liquid handling, you can usually use the same machine, Perkin-Elmer, Hamilton, QIAGEN. All these companies they're now actually increasing production of their systems that are widely used in the world, both for RNA handling and extraction and DNA handling and extraction. Once the sample exits these machines, the sample enters the qPCR, usually using a plate. There might be a step where you need to move samples from tubes to plates, but that step can also be easily automated using technology and instruments by those same companies. So in our lab, we use both Perkin-Elmer and Hamilton, and both of them work extremely well, and both companies have years of experience dealing with liquid handling, automated liquid handling, and RNA and DNA extraction. Now, a key benefit of automation is not just the speed, and so the increased capacity of the lab, but it's also the reduction of the human error. When you analyze thousands of samples per day, if you reduce, even remove human intervention in handling samples, then you can make sure that there are no human errors, and really you can reach a 0% error rate, or at least approach it. Now, once the qPCR machine generates the data, that data needs to be translated into a report, and then finally that report needs to be signed by a medical director or a clinical director, certified by the local country so that it's valid in the European Union. And also this last process needs to be automated if you want to achieve thousands of samples per day. And so the system that we built, it's a software system that first analyzes the positive and negative samples, leveraging the positive and blank and internal controls in each run, and then transforms those samples, those data into reports. And then there is a very simple internal UI that our medical directors can use to create the reports and validate the results. Now, thinking about the future, we can have different outcomes. Personally, I believe that a vaccine will be released within 12 months. There are incredible efforts worldwide. There are incredible investments by both governments and private organizations, both for profit and non-profit. So I'm very hopeful and very positive that we will have a vaccine soon. This said, we can have different types of future outcomes and future scenarios. One scenario is that coronavirus disappears. A second scenario that we will have local sustained cases. A different scenario is that we can have short sporadic chains of transmission. Now, a very interesting variable is also geography. So already today, we have witnessed how China was the first country. And so China went through a period of lockdown and very high number of cases. And now life in China is back to normal. Even just in Europe, different countries are at different stages. Inside the same countries, different areas, different regions have different types of epidemics. It's the number of cases, is the centers, is the number of even like the number of new patients that are discovered every day. And so we can have definitely, we can think about the future. We can think about the next months as a period where we will see some sporadic returns of coronaviruses. On top of that, we have had a situation today where just a small percentage of the population has been affected. It's still a big percentage compared to standard diseases, but it's still like a small percentage compared to the general population. And so now that we get ready to go back to work and we enter phase 2, so back to normality and back to be able to hug our dear ones and go back to the offices, it will be important to monitor the situation and make sure that people do not get sick again, and especially that do not expand the virus again and create new chains of transmission. Now, if this is an estimate that I took from the WHO website, and these are like, of course, these are just future scenarios. So we had our first peak in March and April, and now it's gone down. So in the future, we could have future peaks, smaller in magnitude. Now the frequency of these peaks could remain the same or could increase. Also, if we think about not just coronavirus, but if we think about general high growth diseases like coronavirus or like SARS a few years ago, we have now a situation where we have one of these diseases once every 10 years, more or less. So the question is really number one, what should we expect 10 years from now? Like a new SARS disease, maybe. And number two, will the frequency remain the same, like 10 years? Will it be reduced? Will it increase? Of course, we hope that the frequency will be smaller, so that instead of waiting 10 years, we will have to wait 50 years or 100 years. On the other side, it might be that the frequency will actually increase, and so we will have a new highly effective disease in 5 years or in 3 years. And this is to discover. We don't know yet. But behind what happens, and we cannot predict the future now, it's important that we are prepared to manage future potential epidemics, to prevent future epidemics. Hopefully, the national budgets for research will be increased in every country, United States and Europe and Asia and Africa and Australia. And hopefully also we will have coordinate international effort in managing, especially in preventing future epidemics. So today in the world of genomics, we speak a lot about preventive healthcare, personalized medicine. So today it's time to also think about prevention of epidemics. And we cannot have single national efforts. We need to have coordinated international initiatives. As Dante Labs, we have joined the COVID-19 International Genetic Initiative, and it's been great to see so many international groups provide data analysis and really support each other in the study of genetic variants for COVID-19. So of course, this is the team, and everyone in this slide knows much more about genetics than I do. But so what I will say now is something smart that I learned in the office, and it is that today is not just about getting sick. We see people dying. We see people so-called asymptomatic, so they are affected by the virus, but they don't show any symptoms. They don't even have a high fever. And age, of course, is important, but we have seen very young people dying. And so genetics, of course, provides a defense or puts people at risk. More specifically, there are some variants in our genes that determine whether or not the coronavirus affects a person's health. And it's important to discover these variants and to understand whether it's single variants or whether it's a polygenic situation. And so it would be very interesting in the future to develop a polygenic risk score for coronavirus. And it's important to understand these variants because then thinking about prevention will not just be monitor future potential epidemics, but in the case of a return of coronavirus, prevention will also mean knowing what people are more at risk and what people are less at risk. And so by identifying the variants, the genetic variants that are responsible for serious illness connected with coronavirus, we will be able also to pre-screen individuals, especially medical doctors and healthcare professionals, so that we will know who is more at risk, and we will know who can be in the front line and who should not be on the front line based on their genome and their genetic variants. And this will allow hospitals to select people and doctors really who should work on coronavirus cases, and doctors who should take care of all the other patients. And this will be like a superb way to avoid the spread of coronavirus, and also especially to protect the life of healthcare professionals who are doing a lot these days to support the worldwide population. Thank you.